Now, there's worry amongst public health officials that mass protests over the weekend will bring new outbreaks even sooner than anticipated. Joining me now to talk about this is Yelowitz. He's an economics professor at the University of Kentucky. Thank you so much for your time, Professor.
Thank you for having me. I wish I didn't have to be here under the circumstances, but thanks.
Professor, you recently analyzed the effects of 4 different social distancing measures: sheltering in place, closing restaurants, closing schools, and the banning of large gatherings. Now, what's your reaction to the mass protests this weekend? What effect will those have on the pandemic moving forward?
Last month, my research team published a study in Health Affairs on the lockdown measures, and we found they significantly bent the curve on COVID-19 cases. We also looked at specific policies, as you mentioned, and we found that the stay-at-home restrictions and dining and entertainment restrictions significantly reduced community spread, while bans on large gatherings didn't have much impact. Our thinking is that back in March and April, prior to the stay-at-home orders, what bans on large gatherings did was simply encourage smaller gatherings. That is, people still got together and spread the virus, just in smaller venues. What our study didn't assess, which is critically important for difficult times like we're in right now, is how protests where there's a real chance of super spreaders matters for COVID-19. The circumstances surrounding the community protests against police violence have a real possibility for a spike in infections, although we may not immediately see it.
And Professor, what about the demographics of the people at these protests? Many of them are young, and many minorities, African Americans and Latinos. What can you tell us about those communities in reference to the virus?
Well, there have been significant racial disparities in COVID-19 infections, hospitalizations, and fatalities. There's one recent study published in Health Affairs by researchers at Suter Health Center that find that African Americans are nearly 3 times as likely to be hospitalized for COVID-19 as similarly situated white patients. For the protests, largely the protesters were people of color and much younger people who may be asymptomatic. Both of those potentially mean that the spread of the disease won't be detected for a bit longer because younger people, even if they get the infection, may not eventually get tested. However, older individuals that they come into contact with could eventually get the disease.
What are some of the issues with mass protests that could make an outbreak more likely?
There is evidence from very early in the pandemic about the way in which people either shout or scream, both of which are very important and legitimate things to do during a protest. A study in Seattle found that one super spreader infected more than 50 people in a choir practice because the sorts of activities where micro droplets are spread is much easier in that context. The one difference, perhaps, and hopefully this will matter, is that the protests were outside, and it appears that the transmission is lower outside than it would be indoors.
Well, thank you so much, Yelowitz, economics professor at the University of Kentucky, for your time today.